Hello everyone, in this video lecture we will be discussing the case of temporal arteritis. First we will go through some high yield points of temporal arteritis and then we will move on to the high yield question. So if we talk about temporal arteritis, it is also known as giant cell arteritis. This is defined as the granulomatous inflammation of the tunica media of medium-sized and large arteries. So guys, as you all know that the large arteries that have the middle layer called tunica media, and this disease is basically a vasculitis which involves the granulomatous inflammation of the tunica media of the large arteries. The most common artery that is involved is the superficial temporal artery. So this is the superficial temporal artery, and mostly this artery is involved. If we look at the histopathology of the disease, we see granulomatous inflammation in the media. So it shows the granulomatous, or we can say it shows the granulomas in the media of the artery consisting of multinucleated giant cells and mononuclear infiltrates with narrowing of the lumen. So guys, over here you can see that this is the tunica media, and in the tunica media, what do you see? You see granulomatous inflammation with giant cells. So over here we can see the giant cells. This is another diagram showing the giant cells in the tunica media. What else do we see? We also see the mononuclear infiltrates, that is the infiltrates of the lymphocytes, and we see the narrow lumen. Right. This is another diagram showing the changes due to inflammation. The inflammation results in the narrowing of the lumen, and there are giant cells in the tunica media. Right. What is the median age of the disease? It's 65 years. So it's usually a disease of an elderly female, that is of 65 years or above. And this is the most common systemic vasculitis in adults. Okay, so what are the clinical features? You all should know that clinical features are due to decreased perfusion to the tissues as a result of luminal narrowing and obliteration. We just saw in the histopathology that the inflammation causes the narrowing of the lumen, and this narrowing of the lumen is segmental. It does not occur throughout the artery, it's segmental, and what it does, it decreases the perfusion to the arteries. And the clinical features arise usually when there is increased use or whenever there is obliteration. So the clinical features includes the headache. Headache is usually unilateral and focal and on the temporal region. So headache is usually unilateral, focal, and the headache is temporal. Also, the important thing about this disease is that the tenderness may be present on palpation at the temporal area. So the headache is due to the involvement of superficial temporal artery. Another clinical feature is the jaw claudication. And how do we define jaw claudication? It's the pain during mastication. So as I told you that there's luminal narrowing, and when there is increased work, so the blood supply, there's no increase in the blood supply during the work. For example, when the person is masticating or when the person is chewing, so the blood flow should increase to the jaw, to the temporomandibular joint, but the blood flow does not increase due to the luminal narrowing, and this causes pain during the mastication, that is known as jaw claudication. And jaw claudication is due to the involvement of the maxillary artery, because maxillary artery supplies the blood to the temporomandibular joint. Right. The other clinical features include the monoocular sudden loss of vision. So guys, this is a very serious complication. There is blindness or monoocular blindness, which can occur due to the involvement of ophthalmic artery, and this is a very serious complication of the disease. Lastly, you find polymyalgia rheumatica in more than half of the patients, and this is characterized by pain and stiffness of neck, shoulder, and hip. So, guys, there is stiffness and pain of neck, shoulder, and pelvis or hip. And this may also include fever, fatigue, and weight loss. So, these are the clinical features of the temporal arteritis. How do we diagnose the disease? The diagnosis is simply made by biopsy of the involved artery, for example, the temporal artery. The most high yield point about this disease is that when you carry out biopsy, and if you're waiting for the results of the biopsy, make sure you give steroids before that. So give steroids before waiting for the results of the biopsy. This is to prevent blindness, and this is a very high yield point, very high yield point. You need to give steroids before the results of the biopsy come. Let's move on to the question. A 65-year-old woman, so guys, you can see the age and the gender. The elderly woman comes to the ER with sudden onset of headache, followed by blindness in her left eye. So you can see the monoocular vision loss. She was recently admitted to the hospital for fever, shoulder, hip, and neck pain. So guys, this is characteristic of polymyalgia rheumatica. And weight loss. This patient's condition is most likely due to, what do you think is the answer? The answer is large vessel arteritis, which is actually the giant cell arteritis. Right? So guys, lastly, let me remind you, why do we call this disease as giant cell arteritis? Because we see giant cells on histology. It's a granulomatous inflammation. This disease is also known as temporal arteritis and giant cell arteritis. Thank you so much for watching.